Splinting. So to splint or not to splint. Basically, if you're trying to decide, does this need a splint? Uh, you know, thinking about what are the pros and cons of splinting. Well, if there's any pain or injury to an extremity, it's advised that you splint that extremity. Pros and cons of this, it does take some time. So you do have to think of this in the sense of the context of the entire incident. If we have other life-threatening situations going on, like severe bleeding or airway problems, we are not going to splint that patient if it's going to delay our transport time or delay our time to control the airway or to control life-threatening bleeding or anything like that. So as we've kind of been talking about throughout this entire training, you always want to start with getting those ABCs under control first. But then if you have time in transport or you're waiting for transportation or the patient's not severe, you do want to take the time to splint any extremity where they have any pain, whether that be an open wound, a possible fracture, a possible dislocation. There's really no downside to splinting other than the time it takes and as long as you do it correctly. So to make sure that we splint correctly, that's why we always, you'll probably remember this from your EMT class, and hopefully you're doing this in the field as well. You always check that distal circulation, sensation, and motor before you apply the splint, and then after you apply the splint. That's to make sure that you didn't get the splint applied too tightly, because that can cut off blood flow to the limb and then cause the problem to be even worse. So make sure you're using the proper supplies, that you're not getting the splint too tight, that you're using padding between the splint and the person if the splint is not made with padding, and that the body part is in the position of function. So we'll talk more about the specifics of that at the end of this. So one of the big questions about splinting is, you walk up to somebody and they have, they clearly have a fracture or a dislocation, and you're trying to decide, should I splint this deformity as I found it, or should I try to put it back in place where it normally goes? And to answer this question, we have two things to consider. You want to consider whether they have a severe deformity, and you want to consider whether they have distal circulation, sensation, and motor. If they have a severe deformity, or they have reduced circulation, reduced sensation, or reduced motor, they tell you, I can't feel my hand, or I can't wiggle my fingers, or my hand feels a little tingly and numb. Either of those are the case, or that severe deformity, their arm is looking like they have a second elbow. You do want to try to align the limb to its normal position. And we usually do this by applying really gentle, just kind of manual, textbooks a lot of times call it traction. It's nothing like the heavy traction that we apply to like a femur fracture, but we are going to gently pull as we position that limb back to where it normally goes. Now, as you do that, if you feel any resistance or the patient has any increase in pain as you're moving it, you should stop and splint it where you're at. But if you can move it back into position and they don't have any extreme increase in pain, or you don't feel any resistance, it's totally fine, and it's preferred that you do put that limb back to where it normally goes. The only time you would kind of splint it as you found it is if the circulation, sensation, and motor are fully intact and they have no severe deformity. So the arm looks normal. Maybe you see a lot of swelling. Maybe you see some bruising or some redness, or the leg. It could be an arm or leg. I keep using an arm as an example, but it could be the arm or the leg. And, you just splint it how you found it. They have those good CSMs. It looks pretty normal. Put a splint on it. If something's pointing the wrong direction, gently try to put it back in position and see if you can position it as you would normally find it first. Okay, so how to splint? Again, you'll probably remember this from your EMT training, and in the field, you do this every single time you apply a splint. So it should sound pretty familiar to you, but I just wanted to kind of go through all the steps as a reminder. You do want to check circulation, sensation, and motor. We usually do this by checking for a distal pulse for circulation. Sensation, we'll have them close their eyes and say, which finger am I grabbing or which foot am I tapping? And for motor, we'll ask them, can you wiggle your fingers or can you wiggle your toes? Then we want to get the splint measured or bent to fit the correct extremity. So SAM splints are really commonly used. So when I say bent, those SAM splints need to be kind of formed to the extremity. So you can go, if they broke their right arm, you're going to go over to their left arm, and you can be really aggressive with that left arm and bend the splint up around, that arm to get it formed into the shape that you need. The other thing is when you're bending the splint, if you're using a SAM splint, if we're splinting the hand, we want to make sure the hand is in the position of function. The position of function would be like if they're basically holding, holding something, holding a ball. So you can roll up the end of the splint to give them something to hold on to. If you're not using a SAM splint or something like that that you can roll up, you can give them a pair of socks or a roll of gauze, something to hold in their hand, to get that hand in that position as though they're holding something, because that is the position of function, and that is how we want it to be positioned before we splint it. So we get all that in position. During this time, we have, our partner or the patient, self-splinting. And then once the splint's ready, we will put the splint alongside the injured extremity. We'll have either our partner or the patient hold that splint in place and find the spot that's comfortable. You, at this point, need to think about whether you need to apply any padding between the splint and the extremity. Again, SAM splints are most common. Those do have the built-in padding that's around the aluminum, and so they are fine to just use as is. They don't really need padding. But maybe if somebody has a severe deformity and they have a gap that you need to fill in, or if you're using like a board splint or a cardboard splint, you will need to apply some padding between that person and the splint. Once everything's in place, now you're ready to wrap the splint. We do want to wrap distal to proximal. Now, as far as what material you use to wrap the splint, almost anything works, but I do want to caution you against using the stretchy sports wrap bandages, because the elastic, as you wrap it, it gets tighter and tighter and tighter. So I would recommend, the best thing to use is just roller gauze. It's kind of self-adherent, it sticks to itself, and it'll just stay in place really easily. But Coban does a similar thing. Basically any kind of wrap is going to work. Just make sure it's not one of those wraps that's going to get tighter as you go. Once you get it wrapped all the way up, so distal to proximal, so we'll start at the hand and work up, or we'll start down at the ankle and work our way up if we're on the leg. And then once we get everything in place, we'll double check that that circulation, sensation, and motor are still intact by checking for a distal pulse, asking them, can they feel us touching them, and then motor, asking them to wiggle their fingers or their toes. So that's what I have for you about splinting. I'll see you in the next video. Thank you.